together this program with us. We did this at the World Stem Cell Summit with Bernie Siegel. The idea was to try to create some information, some buzz around the new and innovative scientific principles coming out of the lab, to combine them with the healthcare providers that are working in everyday medical practice, and try to get that information out to the patients and the healthcare providers so they can have a communication that actually makes a difference in patients' lives. So we're here with you, Dr. Mickey Barber, and I don't know all the doctors from the H Management Group. Boston BioLife runs its own courses in the biochemistry of regenerative medicine and translational medicine, but we're very happy to be here with Rick and Greg and trying to help support this organization, because this is really where the rubber hits the road in terms of doctors treating patients. So tell us, why you're here, how long you've been here, and a little bit about yourself and your practice.
Sure. So I've been practicing age management medicine for almost 20 years. I originally was an anesthesiologist, became quite ill when I was in my early 40s, and conventional medicine gave me no answers. So I had to find my own answers and basically cure myself. Once that had happened, I decided to start a practice in age management medicine and wellness, and it's been the greatest thing I've ever done. Ever.
Change anesthesiology to age management, huge difference. But what type of practice are you doing for age management?
So we focus on keeping people healthy. So it's the preventative side of wellness. Part of the structure is looking at hormones, vitamin levels, assessing a patient's physical fitness, cognitive fitness, working on their nutrition, and pulling all those pieces together. So it is from the inside out. We do a little bit of outside in, but it's almost 90% keeping us healthy on the inside and monitoring, staying on top of things, documenting success as patients move through the aging process. So our youngest patient's 24, our oldest patient is 94.
Well, let me ask you about hormone replacement therapy. And Joe, we touched upon this a few weeks ago, HRT. There's so many different avenues of it, and it's not just for men with low T or women going perimenopause, postmenopause. Then they're talking about, you've got the pellets, and you've got the bioidentical creams, and you've got the sublingual. How do you know? How would a patient know who to go to? Which one is the best delivery method?
That's a good question, and every patient is different.
Of course.
I mean, we talk about at these meetings about an N of 1, and so every lab result is your lab result, and you have many choices on the delivery systems that would be best for you, and that's the difference between what we do and what conventional medicine does.
And Joe, why is HRT so important in wellness medicine?
Well, what they find is the root cause of many diseases is the imbalance in the endocrinology of the patient. And these things happen for multiple reasons of aging. What we call as aging can really be defined as the lack of the ability to have oxygen. It focuses on the vascular system. And, some of it, they say aging is a disease. It's a byproduct of our environment. So you have your genetics, which is the blueprint. So think about you're building a house, right? So the blueprint is we're going to build this house. But then you build the house and you move the toilet over here. That's epigenetics. So
Right.
yeah, there's a toilet in the house, but now it's over by the window. So maybe the breeze blows in, or the gutter didn't leak, and now the rain comes in. So now that bathroom is affected by where that house is located, where that toilet is in the house. So if you go back to the genetics, the DNA, and everyone says, oh, we can map DNA, but that only gives you part of the story.
Right.
The genomics element of it, and this is why, two things you said are important. One is personal experiences lead to tons of innovation in this field. There's no stronger motivator than someone that's experienced something. I can count on both my hands and my feet of people that I know that have been personally involved in this industry because they had their own personal experiences. People getting hit by lightning and being in a wheelchair and recovering and going on to be an MMA fighter. That's a real thing. People discovering proteins because they can no longer do surgery, forced into the laboratory environment, then taking that protein all the way through the process, not knowing what regulatory or pharmacological nuances were in front of them. So a lot of times it's the motivation of the individual, but this individual care plan pathway, IMN of 1, really requires a relationship between the patient and the physician.
What is IMN of 1?
Everybody's their own clinical trial, right? And the irony of a double-blind, placebo-controlled, randomized, multi-center clinical trial is, unless you account for the variability of the patient, it's not.
It means nothing.
It means nothing.
Right.
So what we're trying to do is to get doctors like Dr. Barber to work with patients and technology providers to do our own studies. And the FDA recently has acknowledged real world evidence in activities of daily living, i.e., if you didn't have a surgery, you're no longer on drugs, or your this behavioral shift, or you lost weight. On this floor in front of us are a multitude of diagnostic, therapeutic, and tools to calibrate and to quantify how progress is being made. So whether it's a peptide or a hormone or a body composition tool or a skin regimen or a hair restoration, there's a pathway that's specific to you and only you. It's not going to work for me or her or anyone else. Now, people are similar. You can put them into high, medium, low, or no metabolic groups. You can put them into weekend warriors, couch potatoes, elite athletes, and whatever, the elderly. Look at neuro, gut health, MSK, sexual wellness, aesthetics. Those are groups. So when you take this matrix and you consider, but really the patient has to be their own care plan provider. I think that physicians need to become more scientific, and that team has to roll out and do. We outsource our most precious resource to strangers that don't know anything about us.
Well, that's what I was going to ask you. This is amazing. These are the best of the best. The physicians, the researchers, the scientists. How do we get this information to our local practitioners, to every single one of us that are looking for better health? How do we get that out there?
One patient at a time, spreading the word. I really believe that. I think getting physicians like myself in front of more conventional physicians helps, but it's really when the patients go back to their internist and prove the benefits of what we're doing.
Right, because internists aren't typically doing this. GYNs
No.
from Women's Health
No.
are not routinely doing this.
But the good news is things like this, podcasts that are out there, patients are becoming better informed. And so they are spreading the word. I mean, they're the best advertising. It's hard. It's when I first came to an age management medical meeting, I mean, we fit in a tiny room, and it's growing. Part of it is physicians are becoming disenchanted with conventional medicine, and patients are becoming disenchanted with conventional medicine because there is no connection. You're talking about the connection, and there is no passion. What you're talking about, personal experience, allows me to practice passionate medicine because I know what it meant to me, and I'm passionate about bringing that to the patients. So I don't know that you can take a conventional medical practice and morph it into this because you're missing some elements.
And it depends. Sole practitioners, single practice entities like pain management, orthopedic, we're finding a trend. Healthy patients make better outcomes, and our theory is, it doesn't matter if you do your fusions or your joint injections or your hip replacements. If this patient is healthier and lives in a lower state of inflammation,
Absolutely.
and they behave in a way that's consistent with them healing, they're going to do better. So we're not an ology-centric enemy of medicine. It's just we're bolting things on, and after the pandemic, two things happened. Individual care plan pathways became more prevalent. Your immune health became more aware.
Right.
Patients became more aware, and there was a lot of misinformation or disinformation or follow the science, and I think people figured out it was really up to them. But what did we do? We modified behavior. 300 million people got a vaccine. We rapidly developed new technologies. If you told me that we were going to have a nanoparticle with a piece of nucleic acid in it, and it was going to cure us from world, damnation 3 years ago, nobody would have believed it.
Right.
That's exactly what happened.
And science has
In
been
Florida,
working
there's
on
drive-through
this, right?
monoclonal antibody stations.
Yes.
Unheard of. If you really know what that is. This is the most fundamental scientific component coming out of academic research. They released it from the lab directly to the clinic, and our government got out of the way. And things like emergency youth authorization. What a beautiful term.
I know.
Right?
Yeah.
You can do it. We'll let you do it. CLIA Labs. We're a CLIA Lab. We can do this. We can make a test.
Right.
And now the litany of tests, the accuracy of tests, and all these variants that came along. We've never studied a virus or a pathogen like this ever. And now we know COVID down, and it's a SARS derivative, right? We've had these, and we'll have more. But now people are more aware of their health, more aware of their immune system.
Yeah.
You want to live in fear and hide from the virus, wash your hands. And I'm not saying that stuff doesn't work. Maybe we should wear masks during cold season. Maybe we should wash our hands more often. Maybe we need to be more mindful. We all know people that go to work sick and get everybody sick. It's not that far. Sheltering the most vulnerable, looking at other comorbidities, that's where Darwin's theories are coming into play. The sickest are getting it. The most unhealthy are getting it.
Right.
Well,
right.
Dr. Barber, let me ask you, when we're talking about anti-aging, it's also, as Joe's talking about immune system, you talked about immune system. Through what you're doing with your practice, and Joe, through what we're doing, learning here, by supporting our immune system, by making us a stronger, healthier immune system through HRT and through different modalities, do you think it's going to help us overcome future situations, overcome future significant illnesses?
I think that's key. I mean, I feel like we'll need fewer vaccines when we have robust immune systems. We will be able to protect ourselves from whatever variants are out there. When we take the genomic piece of that and add that in, then we'll know who's at greater risk. That will help us to take the right vitamins, the right hormones, in some cases the right medications, so that whatever is coming down the road, we will be fierce and be able to protect ourselves.
It's so exciting because it's not just Botox skincare.
No.
People are really taking a look at their health and their lifestyle, especially in Florida.
Yeah.
But they all have the same root cause. I mean, people losing their hair and getting ED and having belly fat are all in the same vein.
Right. It all starts right in
manifests
here.
itself.
Yeah.
It's like the tree puts a hole in your roof, and some people get some water in the bathroom. Sometimes it rolls down and gets to the foundation. But that's the problem. So what you'll hear is the gut-brain axis. We're looking at gut microbiome. We're looking at leaky gut syndrome. So your gut is one of the front lines of metabolism and toxins. So
It's the center of the universe, the gut. It really is.
it is, but even when you fix that, then you have to go on to all the other stuff that's been damaged.
Right.
And the good news is there's momentum. Groups like this have been out. These guys have been out here for 20 years.
Yeah.
I've only been doing this 6, but I was in medical devices for 20. And in medical devices, there was new innovation. There was new modalities. There was new imaging studies. There was better therapies, right? But I always knew the future would be biochemical, right? But we didn't have the tools. 3 years ago, you had to go to Quest Diagnostics or LabCorp to get your test. And they didn't test for things unless you test my testosterone. That's 500 more.
Yeah.
Test this.
Yeah.
So they go PSA antigen test. You look at white blood, red blood. That's not really that helpful.
No,
cholesterol.
it's definitely.
But when you're doing hormone replacement therapy, should a patient get these levels done prior to treatment? Or
Yes.
are you treating symptoms?
Both. Yes. So we definitely look at the numbers. We want a baseline, but we don't treat the numbers. We treat the patient. And the only way you can treat the patient is by talking to them, finding out their symptoms. And sometimes the numbers, if you treat just the number, you're not going to treat the symptom. And so you have to do both.
And I think what happens is as we age, we don't know what symptoms there are because they're cumulative. So you're a little more tired, right? You're a little more irritable, but you've got a lot more on your plate. You've gained a little bit of weight, but you're also getting older. You don't realize these might be symptoms. This is just what you think it's supposed to be.
Right. I think that there's a shift now. Well, when I became ill at 40, other doctors said, well, now you know what 40 feels like. And I said, what? That can't be true. I mean,
60.
yeah, this cannot be true. And I think there's a shift, and people are saying, wait a minute, I'm 60. I don't have to, be fat. I don't have to, not be able to sleep at night. I don't have to have these hot flashes. I mean, we're extending that curve out of what we're expecting, and that's good.
I feel like we need to move you to Florida. Joe, I think she needs her own podcast.
I love Florida.
No, I think it's great, and we encourage. One of the biggest issues that prevents is communication and understanding. And if you go to I told my primary care physician I wanted to have my testosterone checked. He sent me to a urologist. He put me on Clomid. I'm not having a baby, and that's supposed to help me raise. And I know exercise does it, and certain behaviors do it. And what I like to say is the problems are complicated, but the solutions are relatively simple. Diet, exercise. If you think about us as a mammal, right? Bipedal mammal that can reason. we need the same things that any other animal needs.
Of course.
We need protein and vegetables and fresh air and sunshine,
Sleep.
exercise, sleep hygiene, all of these things. But we get away from that. We're not biologically designed to live in the world we're in. We're evolving quickly, and you see it in the incidence of autism and other disorders that are happening, people, stress disorders, PTSD, neurotrauma of multiple kinds. So as we become more aware, we become more involved. It's really the patient and the healthcare provider, but they didn't exist. So naturopaths, chiropractors, anti-aging, all of these terms have had somewhat sketchy past because there was no science to validate.
Right.
Now there is.
Right.
Our whole goal, my goal, is to look at peer-reviewed publications, studies, and outcomes from all the leading scientific organizations around the world, because we can connect now. It used to be impossible, now it's not.
Right.
I have every peer-reviewed paper on the face of the earth in a database that I sell. It's a subscription. You get credits for it. But I want it because I want the doctors to know, here's the paper. Their patient should know. Why does PRP work for joint injections? Why does hormone replacement work? What about the gut microbiome? What about your neurotransmitters? What about hormones? All these things affect each patient individually, and they all have their own influence based on who that patient is. And doctors like Dr. Barber, they're few and far between, but there's becoming more of them. And as the evidence becomes more available, then you get more of them coming on board. Plus, they're sick of working in the hospitals. They're not getting good outcomes. Surgeries don't work. Drugs don't work. Look at the opioid epidemic. Look at failed back surgery syndrome.
And I think a lot of it is they're specialists for everything. Do you think that age management physicians are going to be the next physicians to oversee all of it?
I look at us as being like the quarterback.
That's what I'm
really.
thinking.
I mean, we get all this information about the patient, about their family, about their lifestyle, and we pull it together. And then we can call in a specialist if they need a cardiologist, and we're going to call in someone that understands what we're doing and all the different pillars that we bring into place to support healthy life.
The coordination of care is so important.
Oh, it's so big. And it's something in conventional medicine that has kind of fallen apart, in my opinion.
I agree.
Absolutely.
And so that's what we do.
I mean, in their defense, they didn't have the same information they have now, and they're constrained by the governance of the entity they work for.
Well, that's true.
If you're the quarterback, if you're playing with your friends, you're calling your own plays.
Yeah.
If you work in a hospital, you
I
don't
agree
worry
with
about
that.
getting sued.
But you're way too nice. Here's why. Many conventional physicians do not read. You're talking about all these peer review articles.
Yeah.
You know, every day my team, one of us will pass along an article for the rest of the team to read. I do not believe that is happening in a conventional medical practice.
It's not.
And you're trying to pay your bills and pay your staff and pay your overhead and your malpractice insurance. So sometimes not to the fault of the physician,
Right.
but to what life happens, right? But your
Right.
patient still needs a coordination of care.
Right.
So there's no reason you can't go to your orthopedic surgeon and go to your cardiologist and go to your GYN or urologist, but then go see an age management specialist and have someone quarterback and coordinate all the medications you're on and the supplements and the HRT and look at it from another side.
Yes.
Absolutely.
Can I bring up one thing really quickly about the FDA?
Yes.
You have a lot of people that are going to be watching this. The FDA has a concerted effort right now to shut down compounding bioidentical hormones.
Why?
Go to compounding.com, please. Read about it. Get on there. Register. Put your testimonials in. Give some money to help the cause. But this is happening this summer.
Based
Promise.
on why? I know they're giving me a 1
Based
minute.
on money.
Well, I
right.
think that's a good message. And do you have a website that you can share with us before you head off?
Yes, it's betterlifecarolinas.com.
Well, thank you, Dr. Barber, for coming
Thank
on.
you.
And
I
all the
enjoyed
things
it.
you wanted, and we'll stay in touch. Make sure you have one of my cards.
Alrighty.
I enjoyed your content, and I think we're going to hear more of this message as we move on because
has been
there's
a
so much
pleasure.
overlap in this, but yet you start hearing consistency and the answers come through, all the different
Joe
speakers.
Krieger, Boston BioLife, Dr. Mickey Barber, Barber, Better Life Carolinas. More to come from the AMMG Training Conference from Doral, Florida. Stay tuned. Thank you, Dr. Barber, so much.
Thank
Joe,
you.
we'll be right back.
Very good. Thank you, sir.